Good evening, Dr. Gaurang. How are you doing?
Hi, good evening. I'm doing good.
Welcome to the session. We are live as yet, but then I haven't kept you on the stream, so we shall just be holding on for a couple of minutes. In the
Okay.
meantime, are you prepared for the session?
Uh, you have sent me some questions, right? So
Yeah.
those are the questions you'll be asking.
Yes.
Yeah.
Those are the questions that I'll be asking you. And
Okay.
most importantly, I just wanted to let you know that this is going to be more like a talk. So it's going to be more like, which is going to be more towards from the audience actually speaking to you. So I'm going to be the audience kind of thing. I'm going to speak their language to you.
Hmm.
That's how things will be. So it's going to be on a lighter note rather than being too medical.
Hmm.
That's how things will be.
Okay.
Just to give you an idea, these talks are going to be hosted by me. I'm myself a functional medicine health coach,
Hmm.
but at the same time, I'm hosting all of these things because I want to make the audience voice to be heard, and we're going to be answering their questions with experts like you.
Okay.
So, welcome to the session, and I'll be
Okay.
putting everything live by 8:15. It's live though, but yeah, I just wanted to know if you are comfortable with everything, your camera settings and everything is fine.
Hmm. Yeah. Okay. Are you able to see my video and audio?
I'm able to see, I'm able to hear you very well.
Yeah.
So no problem at all.
Sure.
Do you have any queries, Dr. Gaurang?
No, I think if there's nothing else I need to do, right? Just you'll just go live with this video and then we'll start.
Yeah, we will do a little bit of an introduction. So it's going to be like this. As I said, these talks are I've kept the name of this talk as Filmy Health Talk. So H. Pylori is the villain, and you're the hero. So
Hmm.
you're the person who fights off this villain. So, but we need to understand the characteristics of this particular villain before we can actually fight. And since you are the person who has been, looking at everything about this particular villain, you are the best person who can let us know how this villain actually, has the next move, what happens with it, and how to fight it because you have the weaponry with you to fight it off. So
Hmm.
that's how the talk is going to go about. And then I start off with the fun facts about H. pylori, and
Hmm.
then after that I shall be giving you a little bit tiny introduction, and then we shall go directly dive into the Q&A. So I'll
Sure.
be asking you the questions which have been shared, so we'll take it up from there.
Yeah. Sure.
Yeah,
Sure.
great, fine. You can I hope you have water with you,
Yeah.
because definitely keep your throat clean. That's very important. How was your day though?
It was good. How was yours?
Very well, preparing for this.
Mhm.
I've just recently joined YellowSquash, so yeah,
Okay.
we'll be hosting a couple of health talks like this with experts like you. So thanks once again. People really need people like you. So thank you very much. Thank you very much
Thank you. Thank you so
for
much
your
for
valuable time.
hosting. Yeah. Thank you.
Perfect. So we just have 2 minutes,
Yeah.
and I'll be introducing. I'm just switching off you for a minute, and I'm just gonna be catching people. Okay, I'll
Sure.
switch you
Sure.
on.
Okay.
Okay, all right. See ya. Right. Hello and welcome. Namaste, Adab, Sasriyakal. Hello and welcome. And I'm going to be your host and your dost from YellowSquash for hosting this particular live session, which we will be calling as Filmy Health Talks. And with us, we will be joining with one of our heroes of the industry, which I will call as heroes. But let's have a look at what our talks actually emphasize on. So, a little bit of an introduction as to how these talks are. I'm pretty sure I can see a lot many people have joined in already. So welcome once again. Thank you so much for taking out your valuable time for listening to this wonderful talk. And I'm going to make it a point to make it pretty interesting for you. This talk is not going to be like any other health talk, which is just a little bit more medical, jargon based, but it's going to be more interesting. You know why? Because it's your voice. I'm going to be taking your voice, your questions, and I'm going to be putting it across to our expert of the day, and we'll be getting live answers. So I want you all to be active, and I want you to be consciously writing it or typing in your comments, your queries across. You can also see that there are QR codes, and you also have a runner going on wherein you can connect with our expert. But in any case, thank you once again for joining in, and I'll be more than happy to now introduce you to where we are, what we are doing. So yes, here we are. Hello and welcome to the live session on H pylori and the functional medical approach which we take for this particular thing. But let's start off with why are we over here first and foremost. So you can see this is the filmy health talk, and आपको पता है फिल्म्स में क्या होता है. फिल्म्स में हमेशा एक हीरो होता है और एक विलन होता है. The villain is always the guy who is extremely strong, and you really need to see how you need to know the features of the villain very well, right? So it becomes extremely important. Just a minute, please. Okay, I was just resetting the stuff so that everything is visible nicely. All right, so we're going to be doing filmy health talks in which we will be talking about the villain, what are the characteristics of the villain. In this case, our villain is going to be none other than the H pylori. Yeah, the name itself is really difficult to pronounce, so it's H pylori. But at the same time, we have the hero who can fight this particular villain. But as we all know, even in movies में सबसे पहले यही बताया जाता है कि विलन के कैरेक्टरिस्टिक्स क्या हैं और हीरो के कैरेक्टरिस्टिक्स क्या हैं और उसको लड़ने के लिए एक्चुअली हमें क्या क्या आना चाहिए. So with that we will actually be coming into a couple of factual features or fun facts, which are also the warning signs, by the way, of the H pylori. So we'll be looking at what are the fun facts of this H pylori. All right. And yes, Dr. Gaurang will be coming in live shortly, so don't worry, just hold on. But we're going to look into what are the deadly characteristics of this particular villain who has been within this world for since longer time. Now, let's have a look at this gentleman which I've shown over here in black and white. You would really won't believe that it was actually in 1982 that these two gentlemen actually discovered this particular bacteria. And this organism, this bacteria, is the only bacteria who is able to survive acid. आप बिलीव नहीं करोगे, ये एक्चुअली एसिड को सर्वाइव कर जाता है, एंड दैट्स द रीजन इट इज रियली डेडली. एसिड से भी नहीं मरता है. दैट्स व्हाट्स हैपनिंग विद दिस. दैट इज व्हाई दिस इज वन फन फैक्ट एंड द वार्निंग फैक्ट जो अपने माइंड में रखना है. नेक्स्ट थिंग वी नीड टू नो कि ये कितने टाइम से हमारे साथ है एंड कितने लोगों को एक्चुअली इफेक्ट करता है. सो मोस्ट ऑफ द टाइम आई हैव सीन जब पीपल अपना एच पाइलोरी का डायग्नोसिस देखते हैं तो काफी सरप्राइज हो जाते हैं, काफी दुखी भी हो जाते हैं, एंड दे फील दैट दे आर द ओनली वन ऑन दिस अर्थ हु इज they are the only one on this earth who are actually, just give me a minute please. Okay, yeah, So I'm sorry, I just had to correct something in the system. All right. So important thing to know is even a person sitting next to your side or even in your family, you might find someone with an H. pylori infection. You will actually see that more than half of the world, in fact, I had heard in one of the talks that it is almost two-thirds of the world that is actually infected with H. pylori. Okay, so you're not alone. That's what it means. So it's pretty common, but it need not be common. Another important fact about H. pylori is that it is very old. I mean, like, really wise old man, very smart old man who actually has been living for since long, long time. I mean, 100,000 years ago. एंड तब से वो अपने आप को और मजबूत करता रहता है. इट इज मेंटली वेरी वेरी स्ट्रांग. इट इज फिजिकली ऑल्सो वेरी वेरी स्ट्रांग, विच यू विल सी शॉर्टली दैट it has actually developed muscles like this. Seriously. I mean, like, it is a gram negative bacteria. And the best part is, it has been developing its muscles since 100,000 years. Can you believe how strong it is? But the most important thing, for every strong villain, this is the villain that we were talking about, right? So for every every strong villain, there has to be something that has to fight off. Okay, now in a normal scenario, H. pylori is normally given, you are given some kind of antibiotics, you have some kind of a protocol that you have to follow, you have to eat these many antibiotics. And even then, let me tell you one important thing that we have observed. Some people see a positive change, and but some people never see a positive change. They see a positive change for some time and then they come back. They keep having this cycle again and again and again. And what ultimately happens is, the answer is there on the screen. The current remedy is not enough. And you can see this. The nation wants to know that current remedy काम क्यों नहीं आती है? What is wrong with the current remedy? Why is it a problem in spite of the fact that we use the best of antibiotics, in spite of the fact that some people do see an effect, some people don't see an effect? So yes, the nation wants to know, हम सारे जानना चाहते हैं कि ये problem है क्यों, and that is why our hero of the day will be helping us out. So just hold on for one more minute. I just want to highlight some important things. You can see this, ये बेचारा गट नजर आ रहा है आपको, बेचारा पेट नजर आ रहा है, वो बड़ी दुखी होके देख रहा है that you know, जब भी कुछ खाता है तो फिर there is this GERD reflex, कोई acidity, कोई indigestion. The worst part, you can see the brain is also affected. आपको mentally भी you are getting so much disturbance. So बेचारे पेट की बहुत बुरी हालत है, and it definitely needs help. Okay, it's screaming help. You are screaming for help definitely because you have tried every other thing on earth and nothing is happening. It's like, you know, your body is not changing, it's just stuck with the H. pylori. And इसी से related फिर हमने यही questions देखने हैं that how can we ultimately help the gut? And that's the reason, that's where we are getting in functional medicine to find out how we can work on the functions of the body and find a way to help our dear gut. And that's the reason we have the hero in the house. Yeah, you know, there are a lot many unsung heroes. Half of the time हम सोचते हैं कि कोई biceps वाला कोई hero होगा या फिर, you know, real fabulous thing. But these are the real heroes, right? There are real heroes in our society who have been helping on and off, that has been helping the heroes have been helping us on and off with so many people who are being affected. And without any further ado, I want to call this hero online and welcome our hero. Just give me a minute before I get Sir online. So, Dr. Gaurang,
Thank
welcome,
you.
welcome to our Filmy Health Talks. And you're the first hero who has joined us. So, welcome. And no doubt about it that I have spoken a couple of things. And there are a lot many questions that people have in their mind. But before that, thank you so much for your valuable time. And yes, how are you feeling? And do you have any comments on what was explained all till now?
Yeah, thank you so much for the wonderful introduction. You've really made me feel like a filmy hero now with the wonderful words and the energy and the enthusiasm you have. So thank you so much for doing this and bringing awareness of this issue also. So I completely agree with you that uh, H. pylori has been a little difficult bacteria to treat because it's there all over in the environment. And if you check 50% of the population's stomach may uh, have the H. pylori bacteria, but what really creates an environment for it to proliferate is when you're under stress. You know, the pH of your stomach is low, your immune system is low, you have taken alcohol, you know, you've
Okay.
eaten a huge buffet meal, or you've eaten a lot of junk food outside, and you create these environment in the stomach where you give opportunity for it to proliferate, and it starts multiplying. And once it starts multiplying, it's very silent. You know, you don't really experience any symptoms, you don't really have any issues. So that's why
Just
uh,
intervening. The
yeah,
best part is that that's what's the secret about this.
yeah,
It's so old, it's so smart, it's so strong, it knows how to hide, and
yeah.
it also it knows that okay, this is coming to attack me, it can protect itself. And I mean, like, something happens to the gut koi problem hone lag jati hai. So uh,
Yeah. So
thanks for
it
explaining that.
basically has mechanisms where it adheres to the gastric epithelium, and it starts producing urea. So uh, it produces urease enzyme, and then because of the urease enzyme, you have a lot of ammonia being produced there. So that ammonia will actually neutralize the stomach pH
Ah.
and actually creates an alkaline environment. So then
Hmm.
it makes itself a conducive environment so that it can keep proliferating. And as it keeps proliferating, it'll start disturbing the stomach mucosa. So, and your body is trying to fight the bacteria, and the body is trying to produce cytokines, inflammatory response, enzymes, and all that. And that also creates an inflammatory environment in the stomach. And in your stomach, what actually happening is whatever your stomach is helping you do, all that function will reduce. Your stomach is trying to protect the lining from the acid with a bicarbonate layer with mucus production. So both of them reduce. And your stomach is trying to produce pepsin and hydrochloric acid
Hmm.
for the digestion, and that also reduces.
Okay,
So that's
Dr.
how
Gaurang,
it
I'm just going to
yeah,
intervene a little bit because
yeah,
most of the time people don't understand these things, when you're talking about bicarbonate, urease, and all of that. I'm just going to get a little more laymanish, little bit less medico. So I'm just going to ask you a question first. Number one, so many people just come to us and they ask us one important question. They say, we have gone to the doctor after the diagnosis of H. pylori, and there's always this protocol. There's some protocol of, like, three times or four types of antibiotic therapies. There are four antibiotics which are given. Now, what is the exact scientific reasoning behind this, and why this actually doesn't work for some people? Like, where is the problem?
yeah. So like you were mentioning in the beginning that it is a strong enough bacteria to survive in a pH of 2 to 4. So it's also a bacteria which can be resistant to antibiotics. So
What is the pH of
that is
our
why we need
stomach?
to use,
What is the pH of our
but it's
stomach where it
between
should
2 to
survive?
4.
Okay, so it
Between
survives.
2 to 4.
The H. pylori survives in
Yeah.
that. Okay.
Yeah, yeah. So that's why we need to use two antibiotics to actually treat the H. pylori. But what we are missing in this is uh, the problem what the H. pylori has created in the stomach. So like I was saying, it is producing the urease enzyme, producing ammonia, cytokines are getting produced, the inflammatory response is there, stomach lining is destroyed, stomach mucosal activity is reduced. So all that has happened, and then we are only looking at treating the H. pylori, getting rid of the H. pylori organism. So when we do the triple therapy used to antibiotics, 75% of the people we can significantly reduce the load of the bacteria.
Okay.
So what happens after that is we continue to give them antacid, so that during the next 1 month of antacid, the stomach is able to repair itself and come back to normal. But the problem is that 25% of the people who did not respond to antibiotic will get back the symptoms within 1 month, because the H. pylori has not significantly gone. It is resistant to the antibiotic, and within 1 month you get back. And another chunk of people will get back the symptoms in couple of months because the other issues have not completely addressed.
So it's something like, just like in a filmy mode, the villain sends a lot of gundas here and there, and one of the gunda is still surviving somewhere, right? And you didn't catch that guy. He was hidden somewhere, and starts making another gang, something like this, right?
Yeah.
Okay. So that's going to be something. This is an interesting guy, this villain. H. pylori is very, very smart. So wonderful. Thanks for explaining that. But I really want to know that how does this H. pylori, okay, how does it actually create all this acidity, katapan and all these things that people start talking about? They have these pains in the stomach. I mean, all those issues. How does it create this problem?
Yeah. So, like I said, it reduces the function of the stomach, which is to produce acid and pepsin and the bicarbonate and mucin. So, what all that is doing is, when the environment in stomach is good, your lower esophageal sphincter, that is the muscle between your esophagus and stomach, will do its normal job. Its normal job is to relax when you swallow, when the food is coming through the esophagus, and then as soon as the food goes into the stomach, it has to contract. So that's the normal job. Yeah. So, but when the pH of the stomach is more, then it's not getting the signals for it to function properly. That is one thing. Second thing is, all the digestive enzymes, whether it's the pancreatic enzymes, the cholecystokinin, and which stimulates the gallbladder to eject the bile into the intestines, the intestinal enzymes, all of them get stimulated with the hydrochloric acid. So when hydrochloric acid is less and your pH of your stomach is more, all of those enzymes are not doing a great job.
You
So
know
that is
what?
why
I,
what you're
I
eating.
just remembered something. Again, getting into the filmy mode. I'm sorry, I'm continuously interfering, but I'll tell you what. Again, it's like, this guy who was hidden somewhere in the barrel. He is releasing, like a laughter kind of a gas, and it's actually changing the environment. It's invisible, but it's changing the environment everywhere else. And you spread the gas from here, somebody else is laughing over there. So it's like the H. pylori sitting over there in the stomach started spreading this, whatever it is spreading, and it goes till the liver also affecting it, the bile is affecting, everything is affecting. So that's how far it actually starts affecting. And that's the reason we start having.
Yeah, so that's why you end up having the digestive enzymes are not able to do its job properly, and that's why you develop. You're not able to digest the food, and that undigested food is producing gas. So the gas is also coming up, and you're contributing to the GID. So the sphincter is not functioning well. Then you're producing more gas because of the undigested food, and also what the stomach is doing is, whatever bacteria you're consuming from outside the environment, it will neutralize it, because like I said, the pH is between 2 to 4. And when the pH increases, that is also not being done. So you're giving opportunity for external bacteria to go and disturb your intestines. Is like Amazon forest. You have so many thousands of species of bacteria, and you have viruses, you have fungi, and you have and that whole ecosystem is disturbed. So this is why you end up having GRD when you continue to take H. pylori treatment for a long time.
So I like that Amazon forest thing. So if you actually, weeds just start anywhere, right? So they can actually hamper the entire forest. Is that what you're telling me? So it's like a weed which spreads like crazy. Is that how H. pylori is?
Yeah, H. pylori directly may not be affecting the microbiome, but it is creating an environment where the small intestinal bacterial overgrowth can happen. Environmental bacteria can get into your system and cause issues. And the undigested food is also creating problems in the forest and causing disturbance to the microbiome. So that's a consequence of H. pylori suppressing your digestive system.
Okay, so it actually works. Everything works indirectly. That's exactly what you're saying. So particularly for GERD, the gastroesophageal reflux disease that people keep talking about, how does it affect there?
Yeah.
How is it related there?
Yeah. So initially, when you have H. pylori itself reducing your stomach acid, you create a low stomach acid environment in the stomach. So that is contributing for the gas production to happen, and that gas is coming up, and the GID is contributing there. But also, when you don't have GID in the beginning, and you continue to take PPIs for H. pylori treatment, that also contributes to GID because, like I said, the lower esophageal sphincter, its stimulus is the hydrochloric acid. So when the hydrochloric acid is low, it's not doing its job, and the excess gas production in the intestines is coming up. That is also contributing to the acid reflux. And finally, the nervous system, which is responsible for the motility of the gut, which is the vagus nerve, which is which is coming from the brain. It travels through the body and comes and controls the gastrointestinal system. So that also gets inhibited, or it gets affected because of the inflammation happening as a result of H. pylori infection, and also because of the ammonia which is being produced in the stomach as a consequence of H. pylori infection.
So coming to vagus nerve, most of the time people with gut issues, especially if I talk about H. pylori, they have been also been in a situation in which they have a lot of anxiety, they have depression, they have mental health stuff. I mean, most of the time they end up with antidepressants, etc., which creates a lot of issues. Is that somewhere related to the vagus nerve?
Yeah, so the H. pylori is the thing about gut is we think it's only for digestion and absorption. So it does a lot more. The hormone which helps you feel good, which is the serotonin, 70 to 80% of it is produced in the gut itself, and the bacteria in the gut is responsible for its production also. So we have to when we create this bad environment, and like I said, the ecosystem is spoiled, it is affecting the serotonin production. Second is the inflammation happening in the stomach is affecting the vagus nerve. So together, vagus nerve, which is a parasympathetic nervous system, which is relaxes the body, that is getting suppressed, that is getting disturbed, and your serotonin production is not happening ideally, and you're releasing cytokines into your system, and you're giving opportunity for the bacterial toxins to get into your system. All that together is affecting the nervous system, the neurotransmitters, and causing depression, anxiety, and mental health issues.
Very indirect, however, definitely, dear, whoever is affected with the H. pylori, I mean, this is something that you really need to be focused on as well, because most of the time, mental health issues are considered something different. Anxiety hai, depression hai, that's totally different, but somewhere deep down, it is also connected to your microbiome and how H. pylori is affecting that. So, coming to the most important thing, so how does functional medicine assess all of this? What are the tests that are used to understand, with what's happening with H. pylori and what is happening with the related issues? Because we always talk about bio individuality, because every person is unique. So, how does FM assess all this and bring that bio individuality?
Yeah. So functional medicine is basically looking at how the body is interconnected, how uh, the disease is manifesting in the body, and in each person it may be in different ways. So we are trying to identify all the root causes and also address the issue. So how is this different from conventional treatment? Is the conventional treatment is only looking at getting rid of the H. pylori bacteria, but in functional medicine we are trying to I'll first talk about the diagnostic. So if you have been having H. pylori for a long time, and a consequence of H. pylori, you experience a lot of other symptoms. So another thing which I didn't talk about is the consequence of your digestion not happening well because of lack of stomach acid and the pepsin and the digestive system getting suppressed is not absorbing nutrients enough. So people with H. pylori infection for a long time end up having iron deficiency, B12 deficiency, vitamin D deficiency, and some of the mineral deficiencies also.
Right.
So when it comes to diagnosis, we need to not only diagnose H. pylori, but also identify all the consequences of H. pylori. Look at the micronutritional deficiencies by doing blood tests. If you have intestinal symptoms like bloating and altered bowel habits, generalized weakness, food intolerances, somebody in the chat was mentioning not tolerating milk. So all these intolerances is also a consequence. So we need to look at the changes happening in the gut microbiome. So we also can look at the DNA and the RNA of the stool sample, which will analyze the entire diversity of the gut microbiome. Is there any pathogen which is high, opportunistic bacteria which is high, foundational microbiota which helps our body which is low? Identify all that. And another thing we can also see is these microbial imbalances will produce some microbial metabolites which get into our bloodstream, which can also be detected in the urine. So we can also identify that and see if, because of excess antibiotic, is there yeast overgrowth in the intestine? Is the yeast overgrowth contributing to the whole problem? And then with all this information, the looking at nutritional deficiencies, looking at gut microbiome, and looking at urine metabolites to identify imbalances, and also the metabolic imbalances happening in the body as a consequence of nutritional deficiencies, we can really come to a personalized solution. And sometimes in gastroenterology departments, we don't get enough time to spend with the patients. So there are advanced tests available in our conventional gastro also. Like we can do a culture of the biopsy and see what resistance the bacteria has. We can do a molecular test, a PCR test for the bacteria. So we can, but the thing is, many times we don't get enough time with the patient, so these are not done. So in functional medicine, we really spend about 45 minutes to 1 hour to really get into the depth and analyze all the problems. So that's how we come to a conclusion and assess the root cause.
Wonderful, wonderful. Spending a time getting to know the history of the individual, from where they're coming from, where all things have happened, and then coming to a point wherein you can give the diagnostics and the tests that are there. So, your story is pretty fascinating, Dr. Gaurang. In fact, you come from the conventional medicine. You come from, you've been a gastroenterologist. In fact, you've even cut open stomachs and you've seen everything. You've been a surgeon as well. And then you have also started functional medicine. So, how have you seen things changing for the patients, and what are the results that the patients can expect with the functional medicine approach?
Yeah, so the reason I got interested in this is because I was actually working in one of the most busy gastro departments in our state, Karnataka, in Bangalore Medical College. So I would see patients coming again and again with the same problems. We would suppress their symptoms with our medications, and patients would come back with problems. And the endoscopy, colonoscopy, scans, everything is normal. We're not able to identify anything, but the patients keep complaining of the same issues, emotional issues, the mind getting affected, vague abdominal problems. And that's how I came across the microbiome. But even in the conventional gastroenterology, we are not yet looking at microbiome in a big way, in a deeper way. So that's how I found functional medicine, which is actually going very deep into biochemistry, analyzing all the biochemical changes happening in the body, understanding the gut microbiome also. So that's how I got interested. And now when I actually implement these in my conventional care, I feel the results are much better than just using medications. So definitely, I have seen radically better results with combination of the functional medicine approach to the conventional gastroenterology. So
Wonderful.
Yeah.
Sorry, you wanted to say something?
No, I thought you had internet connection, so I was just.
Yes, and we did get a couple of questions in our chat, and I wanted to take a couple of questions from the chat. So let me just pick. We'll be picking up a couple of questions. So yes, just hold on. So I'm just going to take this question from Smita. So Smita says, Smita Chaklababi says, some doctors advise to drink cold milk to cure burning sensation in the stomach. So is that right? I mean, can you? And some people also say subsequent, but doctors suggest not to drink milk due to lactose intolerance. So
Yeah.
what can be done?
So now coming back to the mechanism of H. pylori, so we are suppressing the stomach acid and consequently reducing the digestive enzyme. So you don't really have deficiency of lactose, but then I mean the lactose dehydrogenase enzyme, but then consequence to the inflammation happening, the lactose dehydrogenase enzyme function may reduce. That is one thing. But the more important thing about milk is it is the casein, which actually is not getting digested well uh, because of the suppression of stomach acid and the pepsin as a consequence of H. pylori. So that is why if you take milk, you may get bloated and you may have little indigestion. So that is why we recommend you not to have milk. But the cold milk is actually causing, it's adding a little alkaline environment to the stomach. So temporarily your symptoms may feel a little better, but to digest the milk after it goes into the intestine may still be a little bit of an issue. So I would, it would be better to not take milk initially, or if you're taking milk, take it with a digestive enzyme, and then gradually you will be able to digest milk.
Okay. So Alka Purna asks a very interesting question. She says, can H. pylori be eradicated permanently?
Yeah. So the problem, the what we need to achieve with this is creating an environment for H. pylori to not come back again and again. So that's what we do in this holistic approach. We are eradicating it, reducing the load of H. pylori, and then we have to give nutrients for the stomach to get back its mucosal integrity, its protective layer, and its the digestive function. So we give the nutrients required for the stomach, and then we have to give you the good bacteria like the Lactobacillus reuteri and Lactobacillus rhamnosus and some of the Bifidobacter strains. These are available in curd, so they will have a mild H. pylori suppressing action, and also it can create an environment for the stomach to not allow the H. pylori to come back again. So this has to be an ongoing process, and you also have to make sure that the lower intestines are also getting better. If you continue to push foods which are difficult to digest and that's not happening properly, then that is also not allowing you to heal completely.
Okay. All right. And in fact, Mr. Raghu had a couple of questions wherein he wanted to also know about where do we get these tests done. In fact, he has also been mentioning that he probably feels that his H. pylori infection has come back. So that's his question. I
Yeah,
think I'm
so
reinfected with H. pylori, and he wants to know where he can get his test done.
the conventional tests to detect if you have got the H. pylori infection again is possible in any gastroenterologist clinic. You do an endoscopy and test it with the biopsy, or do a stool H. pylori antigen test in any of a good lab, or do a urease breath test, which is not very accurate but still give you some results. But to really understand the treating you holistically and assessing the consequences of H. pylori and treating that also, it would be better to have a proper consultation and then do it instead of just testing everything, because if you end up doing all the tests, that itself will become expensive. So it's better to understand the whole problem, do the consultation, and then we can personalize and do what is really required for you.
Okay. In fact, we also had this. I think everyone has been telling about this particular question. I wanted to highlight. Says Mr. Raghu says I used the Sampros HP kit for 14 days during medication. I felt some improvements, but after that, within a week, my health became as it is earlier, mostly reinfected. So, what are your thoughts on this?
Yeah, so this is the areas where some people are resistant to the antibiotics. So some of the advanced tests, like looking at culture of the biopsy, or looking at a molecular PCR test of the biopsy, will help us uh, understand what antibiotics will work and what doesn't work for that person. Sometimes I've seen people who don't respond to antibiotics also respond to this holistic way of looking
Okay.
at the functional medicine approach, the 5R approach, which we mentioned, creating an environment for it to not survive, giving the nutrition for the stomach, giving the good bacteria which suppresses the H. pylori, and also stimulating the vagus nerve. I think one very important thing which we didn't talk about here is what we can do to improve the vagal tone in the body, because vagus nerve is also impacted with long-term H. pylori. So it's very simple things which create a huge impact for vagus nerve. Is a vagus nerve comes out through the brainstem and goes across the neck and gives branches as it passes through the body. So wherever it's giving branch and whichever muscle it's supplying, we can just stimulate that muscle, and the vagus nerve indirectly gets exercised. So in the mouth, you do oil pulling, you gargling, do a gag reflex, you chant or sing, and you do pranayama, breathing exercises. The diaphragms are moving, and that itself actually works very well for correcting some of the non-specific esophageal motility issues, where the endoscopy is normal, we're not getting answer, you're getting reflux symptoms, the GID is not coming down. Vagus stimulation itself gives a big relief with that.
Wow. Wow. Nice. Nice. We had another question on a similar way from Harish. I used HP kit 14 days, but after burning in stomach and heartburn, new persistent issues came in. So, what about this?
Yeah, so after you finish HP kit, basically the antibiotics itself is a little rough on the stomach, so that itself can cause acidity and some amount of inflammation to the mucosa of the stomach. So we have to continue to take PPI to not have the consequence of antibiotics. So although PPI is counterintuitive, but if you're using antibiotics, there's no other option other than taking PPI for another 14 days, so that you're giving some time for the inflammation to reduce and for the stomach to repair itself.
All
And
right.
another thing about the triple therapy is, if you do it for a long time, you take PPI for a long time, the less stomach acid is also contributing to GID. It is relaxing the lower esophageal sphincter. It is causing gas production to happen in the small intestines, which is coming up. And that you are facilitating GID by taking PPI for a long time. So that also is happening. So we need to figure out which one of this is contributing to this.
So we had, we'll just take one more question and one more last one. Ashok Sharma says whether VSL3 capsule can be taken by a patient suffering from H. pylori and ulcerative colitis.
Yeah, VSL3 is one of the most researched and studied probiotics, so it's predominantly safe. But like any other probiotic, VSL3 is a broad spectrum probiotic. It has few strains of uh, the bifidobacter and the lactobacillus. So when you have intestinal bacterial overgrowth or dysbiosis, imbalance in the gut bacteria, sometimes you don't tolerate probiotics. So if you're not tolerating VSL3, the answer is there is imbalance between the good and the bad bacteria in the small intestine, which has to be first corrected, and then you'll be able to tolerate VSL3.
And finally, we got a couple of questions saying, can we summarize what is the functional medicine approach towards H. pylori?
Yeah. So in functional medicine, we basically we'll start with assessment. So we want to assess holistically and not just identifying the H. pylori. So we want to understand what is H. pylori done to your body, because for all of the people it may not be the same consequence. So first is, has it reduced your digestive enzyme function? So are you digesting properly? We have to understand that. Second is, has it impacted your immune system? Are you having food intolerances? Are you, the food which you were eating before, has it affected that? Then we have to understand, is it causing dysbiosis, imbalance in the small intestinal bacteria also? Are you getting bloated? You're getting GID because of the gas production. And then we have to understand, if is it affecting your nervous system? Are you, is there any mental health issues coming up after H. pylori has caused? Once we identify all the functions of these and see what all problems you're having, then we start identifying what is contributing to that. And that's where our 5R approach comes for, is where first we remove all the things which are contributing. You're not digesting milk, wheat properly, we remove that. You're having sugar and that's feeding the bad bacteria, you have to remove that. You're eating foods which you're not tolerating and spoiling the environment, we'll have to remove that. So once you remove the contributory aspects, and is your H. pylori not completely eradicated with antibiotic therapy, then we use some herbs which can suppress the H. pylori, like mastic gum, berberine, bismuth citrate, and then support your stomach to create an environment where H. pylori doesn't replicate. And second step is, we need to support your digestive system. So the fundamental issue here is, it is reduced your stomach acid function, which has consequently reduced your digestive enzyme function. So temporarily, until you get a little better, we will have to give you some digestive enzyme. If you look at the gastroenterology textbooks, until you have evidence of fecal elastase being low, or you have evidence of bile acids not there in the stools, we don't start digestive enzyme. But we have seen repeatedly in these patients that just adding a low grade small digestive enzyme significantly reduces bloating, you're digesting better, your symptoms gets better, you create a better environment in the intestine. The third step is we need to support your stomach to get back to its original shape and form. So there are specific nutrients like L-glutamine, zinc, carnosine. You get aloe vera, slippery elm, which form a protective layer in the stomach. So those nutrients, some of it can be got with food. Like you take cabbage juice, you have more L-glutamine in that. So you supplement those nutrients which will get your stomach lining and intestinal lining back to its original shape. The fourth step is to give you the good bacteria, because that is what is also contributing to the whole issue. The antibiotics have reduced the good bacteria. H. pylori inflammation itself has suppressed the good bacteria. So there are specific strains which suppress the H. pylori. So we start with those strains and then give you broad spectrum probiotics like you mentioned VSL3. And finally, the most important step is to balance your vagus nerve. So you need to relax, you need to meditate, you need to do pranayama, do the lifestyle changes to support your system to find the balance, give rest to your sympathetic nervous system, stimulate your vagus nerve and support your nervous system, which relaxes your body.
Wonderful, wonderful. So it's basically the 5 hour approach, which around which the entire functional medicine for gut actually comes into, for H. pylori actually comes into. So wonderful, wonderful, wonderfully explained there, and we have taken a little more of your time, but.
Yeah.
Thank you so much. Are there any last words that you would like to tell to, so first and foremost, there are so many patients whose lives you have changed through the functional medicine approach and through all the things that you do. And I also want to highlight one important fact to all the viewers who are watching us, that Dr. Gaurang does a holistic kind of an approach, truly holistic in nature, because he comes from both the allopathic, from the surgery background, and from the functional medicine background, and he culminates all of that and then gets the results. So wonderfully done, definitely wonderfully aligned. Very, very thankful to you, doctor, for changing a lot many lives. Any last words that you want to tell to anyone who is suffering with H. pylori? What is the
Yeah.
hope that you would like to give?
Thank you so much for all the compliments and your kind words. Just one last question I'll answer is people with long-term H. pylori will be saying that I've been taking PPI for so long, I can't get over it. So getting the PPI out is also a skill. So there are many changes which the body is going through when you take PPI for a long time. So there's an enzyme hormone which is called gastrin, which is trying to tell your body that please produce more stomach acid. Your food is not getting digested. But your stomach is not able to produce stomach acid because the PPI you have been taking. So there is piling up of gastrin happening in the stomach without the acid coming out. So if you suddenly stop PPI, the gastrin pile up will overstimulate your stomach. You'll end up having stomach ulcer and you'll end up having gastritis. So that is why it has to be done in a proper manner.
Phased
We have
manner.
to supplement digestive enzyme, reduce the inflammation in the stomach, so that has a negative feedback. Your gastrin is slowly reducing, and your gastrin is not giving the signals for your stomach to produce acid. And then gradually we have to taper off the PPI. If you have taken for a long time, it will take a couple of months to get out of PPI.
Wonderful. So it clearly shows that the treatment would be a little longer, but however, it's going to be for the long term as well. So wonderfully explained there, Dr. Gaurang. And thank you once again for spending your valuable time with all of us and, of course, the viewers as well. So thank you once again for actually helping lot many people out with these particular talks. This is what we aim to do at YellowSquash as well. Definitely. Thank you very much, Doctor. With that, I would like to say, please take care of yourself, of course, and good night to you, Doctor. And for the viewers, if you're looking in for a functional medicine approach, you can definitely contact us on this particular the number which is specified on the scroller that you can see, or maybe you can scan the code. I'm also giving you a scan if you have a query. You have queries for us, let us know. You can scan this particular code which is available on the screen. Talk to an expert, get a consultation done. Everyone is unique. As you said, even the doctor said there's a bio individuality. You need to know your individual nature and how the 5R protocol should work for you. So, to get to know about all of that, scan the code, talk to the person, talk to the health expert that we have for you, especially for you. And thank you once again for joining us. Please like, share, subscribe to our channel if you have liked the content that we have shared. And remember that we'll be continuing with these filmy talks as well. We'll be connecting with another hero. If you have another villain in your life, or if your friend has a villain in their life, if your loved one has a villain in their life and you want to eradicate that, send it to me, put it on the comment, put it anywhere, send a query across. I will help you out to chart out where is the hero. I'm going to get that person here. You come with your queries. I'll be more than happy to help you, because I'm your host and your host, Coach AJ from YellowSquash, your health ambassador who will be looking into this. Please suggest us if there's any particular topic that you're looking for and you are desperately looking for a query. I will desperately look for the hero for you. Get it over here, get it live, get your question answered live as well. So, for similar sessions, once again, like, follow, share, subscribe to our channel, and I look forward to seeing you in our next talk. And we have our next talk on child development disorders. If there is someone who is interested, and if you feel somebody needs to check on that, wherein any child is suffering from autistic kind of behavior or child developmental issues, we'll be talking about the child developmental issues and functional medicine approach through the heavy metal toxicity. So if you find this fascinating, if you feel somebody can benefit with this, do send the link across, share the channel, subscribe, like, and share as much as possible. Thank you so much. Take care of yourself. Have a wonderful, wonderful weekend. Good night. See you in our next health talk. Bye bye. I'm signing off, Coach AJ.